Welcome back to Titan Mind. In our last episode, we learned that 1 in 4 people carry the heavy burden of anxiety. And Dr. Kamal dropped a major truth bomb. Medications are our friends, not enemies. But today, we're pulling back the curtain on how these meds actually work, their side effects, and a major structural problem in modern psychiatry. Dr. Kamal, welcome back. Let's start with a hard question. When someone is prescribed an anti-anxiety medication, what is it actually doing in their brain software? And why shouldn't they expect a magic pill fix on day one?
Thank you, Ali, for giving me this opportunity. This is third in our series. I would like to remind that our videos are not intended for professional people. It is more informative video for the layperson. So it should not be considered as professional advice. We have talked about anxiety in our two previous episodes because I consider anxiety is the biggest problem in the field of mental health. And in fact, it may be one of the most common medical suffering in the world. So today we are going to talk about anxiety and how it can be treated. That's our main focus today. And we know that anxiety does not build up in a day. So responding to your question, why it cannot be treated immediately, why does it take a long time? You have to understand that humans are dynamic. They are changing every day. The changes may be very slow or subtle, but we are not the same person which we were a year or 2 years ago. And both physically, psychologically, our personality. That is why it is important to consider and tailor treatment for each individual specifically and at the present time. Whatever has worked, say, a few years ago may not be very effective at this particular moment of time. So it has to be tailored according to the present circumstances. Psychiatric personality and emotions and mind frame and the way of thinking, they are not built overnight. We are all product of our past experiences, and a lot of trauma, unfavorable experiences may influence our personality over a range of time. I will say that there are two major ways of treating anxiety at the present moment. One is various types of therapies, which can be individual or in group. In another session, we can go in more details about different types of therapy, their merits and demerits, specific patients, what type of therapy would be a better choice for one person. But we will leave it for our one of the next videos. So we are going to talk mainly about medications.
That's a good idea. We can focus on those topics the entire episode next time. Get hyper practical for everyone watching who is currently taking or considering taking anxiety meds. What are the common everyday side effects people should anticipate? And more importantly, what are the hidden flags someone needs to look out for that mean call the doctor immediately?
Okay, I think it is a very important question, and we will tackle that in detail a little later. First, I want to talk about who is a good candidate for medication. Whom should we recommend medication for? As you understand that anxiety is a natural psychological phenomena, we have talked about anxiety and performance curve, which is a bell-shaped curve. And as anxiety increases, our performance increases. But after a certain point, as anxiety increases, our performance decreases. And as our performance decreases, anxiety can manifest in two ways. There are physiological symptoms and there are psychological symptoms. In physical symptoms, we may have muscle twitches, we may have heart racing or heartbeat, we may have various forms of psychosomatic diseases, such as edema, such as diffuse body pain. I think fibromyalgia has a strong anxiety component, migraine headaches, tension headaches, back pains, lower back pain, abdominal pain. Because we have talked about the mechanism in our previous videos, I would not go there. So these are physical symptoms, butterflies in the stomach, diarrhea. And then there are a set of psychological symptoms, like the person is unable to relax. They are unable to relax and sit comfortably. They are on the edge. Increases our irritability, and people are easily offended by some remark. And sometimes in acute anxiety, anxiety is defined into different categories. We talked about it: generalized anxiety disorder, panic disorder. And in panic disorder, there is an intense anxiety which is focused on a certain period of time, and it may make your mind blank. You are unable to talk, you are unable to participate in an interview or any other situation. In anxiety, you have a feeling that something is not wrong. Anxiety is defined as fear of unknown. So you are always anticipating that something bad is going to happen. And sometimes psychologically, you developed other symptoms like OCD symptoms to neutralize anxiety. You are unable to focus on things. And a lot of people think that they have ADHD, which is actually basically anxiety, underlying anxiety. They have problems in falling asleep. So your mind just wanders from one place to another, which affects your overall well-being. So anxiety affects human body in physical symptoms and emotional symptoms. And once we have said before in one of our previous talks that the deciding point when to initiate anxiety is dependent on patient. First of all, patient has to realize that there is a problem, and then he has to decide that he is ready for treatment. And then he or she has different option if they want to start with therapy, with medication, or both. But if somebody comes to me as a patient, as a psychiatrist, I would determine his functioning level. How is he functioning currently? And if his functioning level is compromised because of his underlying anxiety, I can recommend different forms of treatment. As we said before, that anxiety is under-recognized and under-treated, and a lot of people suffer in silence. And there is no need actually. Anxiety pulls people down, and they are unable to perform to their best abilities and be successful in life. And people with even high anxiety can be very successful in life, can hold job, can perform as a father, in different relationship, as an employee. Now I will move to medications.
Please.
So what are the types of medication which we use? The most important medication is a group of medication which is called SSRIs, which is an abbreviation for selective serotonin reuptake inhibitor. The first one which was developed, it was in Indiana by Eli Lilly, and it was called fluoxetine or Prozac. When the trials were going on, they were actually trying it as an antidepressant and to treat. That is why it got a name as antidepressant. But after a period of time, people realized that these are the best medication for anxiety. But there is still some confusion in the minds of people. Like one patient once told me that, "Doc, I'm not even depressed. Why are you giving me an antidepressant?" And I had to clear him that the name may be a misnomer. It is much more than antidepressant. Actually, to tell you the truth, it is a weak antidepressant. There are many more better effective medications also, but these are considered now as a medication of choice for all sorts of anxiety disorder, and we call them collectively anxiety spectrum disorder, and they are classified according to certain characteristics. So Prozac was the first one to came into the market, and it was a huge success. I still remember that its picture came on one of the magazines. I don't remember it was Newsweek or Times, but it was a detailed article that how it is changing life. A lot of books came on Prozac. So it was a miracle drug. It was a great advancement in the field of medicine and science. After Prozac became popular, a lot of them came into the market one by one, as Zoloft, such as Paxil, such as Lexapro, such as now, one thing I would like to mention that every medicine has two names. One is called brand name or commercial name, which is given by the company who manufactures it, and it is usually known where it is sold. The other medication name is generic or chemical name, which is universal all over the world. So if you say fluoxetine in any country of the world, people will understand, or pharmacists will give you. But if you say Prozac, some people may not be aware of this name. In any case, they are one of the best medication. However, one of the disadvantages that it takes about 6 weeks to be fully effective. And patient has to be told that in some patient, it may paradoxically agitate them. And it is very important to warn the patient about it, because they may experience tightening of their face muscles, their jaw muscles, or they may feel a little bit more or worsening of their anxiety. And they have to be warned about it. Otherwise, they will stop taking it. And that is why it is very important to start on a small dose so that their body can get accustomed to it. When we are starting the medicine in the beginning, our object is not to treat the problem, but to make the patient accustomed or familiar or used to taking medication. Like, for example, the usual dose of Zoloft is 25 to 50 milligram, which is also known as sertraline, but you can go up to 200 milligram. So you also have to differentiate between allergies and side effects. Allergies are a specific biochemical reaction where your body is trying to reject it, and it has particular symptoms and signs, while side effects can be very varied, and it can be psychological or real. There can be some psychological effects as well. One thing very interesting I want to tell you from my experience, that patients who are taking the same medication for depression, they are much less likely to develop any side effects because they are so depressed they don't even want to live. They don't even care. But in patients with anxiety, they are already afraid of fear of unknown, which is the typical dictionary definition of anxiety. So when they start taking medication, their anxiety finds a focus which is on side effects of medication. Some of the side effects are very well known and we appreciate it and we know. A lot of patient develops diarrhea, flatulence, sweating. Some patient develops sexual functioning, especially reaching climax. But fortunately, for most of these symptoms, if you continue taking them, they will go away and your body will get used to it. So it is very important to explain the patient and make and reassure them that keep taking it. And I tell my patients that if you have taken your SSRI for 2 weeks, then you are half successful. You have already much ahead. So there are different medications and techniques to deal with the side effects and manage the side effects. Fortunately, these medications have been observed in as very safe in long term, and there has no or minimal recording of any body damage organs. SSRIs has an advantage also that in some cases they can work as taking a small amount of aspirin every day. They reduce platelet adhesions, which is an extra benefit. In very elderly people, you may monitor their bone density, but these are very mild or negligible side effects, in my opinion, even if you continue taking it for 20 years. I will talk later that when do you decide to stop or when do you think that I don't need medication anymore. The second line of drug, which is called Buspar or Buspirone, and it is not an SSRI, but it works through serotonin. It is a second choice of medication. It is not as effective as SSRIs, but some people have found it very helpful. So it can be used alone or in conjunction with SSRIs. The only problem with it is that you can have some patient little dizziness, but it is one of the most safe side effect medication which the pharmacy carries, and you have to usually take it at least 2 or 3 times a day. The third medication which is commonly used is called hydroxyzine. And hydroxyzine is actually an antihistamine, very similar to Benadryl, and its sedative properties help in acute circumstances. So I don't recommend people taking it for more than a month or two, or may just take it at bedtime. But it is not a medication which you will need for a very long period of time. Now, every medicine has its own advantages, disadvantages, even the therapy, we have talked about it.
We know many people dread the idea of taking a pill every single morning. They want what's called an as-needed option. You've mentioned that a simple common blood pressure medication like Propranolol, a beta blocker, can be incredibly effective for situational anxiety. Can you explain how a blood pressure pill stops an unexpected wave of anxiety? And who is the ideal candidate for an needed approach versus a daily regimen?
Excellent question. And as I said, there are different type of people with different requirements and a different way of thinking. Some people don't like the idea of taking medication every day, which is actually an ideal for dealing with anxiety, to take medication every day. And a lot of time, a single SSRI pill will take care of it. but we have to deal with different circumstances and devise different strategies, like adding an adjunct, Buspar, adding hydroxyzine. And some have noticed that some blood pressure medication are actually very effective in treating anxiety. Two types of medication which is used. One is called beta blocker and one is called alpha blocker. Among beta blocker, there are selective type of beta blocker, which means that they only act on heart and not on different parts of body's beta blocker. Then there are non-specific beta blockers, which can affect more than heart, different system. Usually general physicians tend to prefer a selective beta blocker as metoprolol, which does not affect other organs. Like there's a saying that beta blockers worsen your asthma or may even cause depression, although I haven't seen much cases of that. I still prefer propranolol because of its inherent property that it crosses blood-brain barrier. And secondly, it has some unique capabilities which are very helpful in treating anxiety. I have a lot of patients with resistant blood pressure, and they have been prescribed different type of medication like angiotensin converting enzyme inhibitor or calcium channel blockers, and their blood pressure is under control, but they have to use very high dose. In such cases, I have seen that propranolol acts miraculously and brings the blood pressure down with even a small amount, and the patient's overall sense of well-being increases and his or her anxiety increases. So my advice to my colleagues who are family physicians, cardiologists, or nephrologists is that if any patient is coming to you with psychiatric issues, try propranolol. There are another blood pressure medicine, which is called alpha adrenergic blocker. One of them, which is very commonly used, is called Prozocine. And Prozocine is very effective in nightmares or body movement, especially in veterans for PTSD cases or sexual trauma victims. Similarly, there is another one which is called clonidine with similar properties. It calms you down, also is used widely in children with ADHD. Now, there are psychological symptoms and there are physical symptoms. So beta blockers, by its nature, they reduce the heart rate. So your heart thumping against the chest in high anxiety, it goes down. It also helps with tremors. So a lot of people with high anxiety has tremors, and it controls the tremors. And it also helps impulse control, which is an inherent effect of propranolol, that it stabilizes your temperament. So a lot of time, even the side effects of medication can be therapeutic in some other condition. And one should take medication. It depends. As I said, human beings are not constant. So my advice is, when I see some patient for the first time, as I said, it is highly individualistic. No socks fits all. You have to take multiple things into consideration, and that is what a good physician does. The size of the patient, the weight of the patient, family history. Has he or she been tried on any medication before? Has he or she found any medication effective before? Their earning capacity, their insurance, their desires, what they want to take, their preferences, because the patient is a partner with you in treatment. It can't result in successful treatment. It should not be like the operation was successful, but the patient died. So our first priority is the patient's happiness, their stability, and a good working relationship with the patient. I always advise patient that don't abandon immediately. Work with your doctor. It may take time, and treatment is not like switching the electricity on and off. It takes time. So take medication, say initially for a year. And if you are thinking that I am improved and my problems were more related to situational, take into confidence to your doctor and try to taper down your medication and see how you do. If you improve, then you can stay without medication. If you feel that you are worsening, then you can restart medication. This principle is applied on many different conditions. Seizure disorder, for depression, you have major depression, we recommend that you take the medication for 1 year. If you have recurrent major depression, we recommend that you take it for 3 years, then we try to taper down. And if it reoccurs again, then we recommend you take probably for life. So what I want to say is that taking medication is not a sign of weakness or character. We are not so concerned about taking medication for diabetes and high blood pressure or any cardiac condition. So psychiatric conditions are also biological condition, and they will not harm you irreversibly, or it will not shorten your lifespan. There are people, I tell them, somebody is 70 years old and he has started on antidepressant. I said, even if you live for next 40 years, you can continue to take it if need be. Your good physician not only just prescribes medication, he has a hand on patient's pulse and always tries to minimize medication as well. What is absolutely essential, what is not. So it is important to describe and recommend to the patient that this is, I think, absolutely essential or in your best interest, but you make the decision. I'm just recommending. But taking medication for long term, I don't see any problems with it.
Let's turn to spotting the progress. If a medication is working successfully, what are the actual real world changes a person starts to see in their daily routine? Because often people don't notice anxiety leaving, they just notice their life getting smoother. How do you track that success clinically?
It is another very important question, because the patient has to realize that he is getting better. He has to be convinced. And there are many different ways. In psychiatry, we still don't have any apparatus like a blood pressure where you can measure, and you can say, hey, your anxiety was 80 before and now it is 40. Although there are methods of measuring it indirectly, as I mentioned, there is a type of therapy which is called biofeedback. In biofeedback, what is done, that is, the patient is hooked to a machine with different type of sensors which measures your heart rate, your breathing rate, your nerve conduction test, skin conduction, nerve conduction, and many other parameters. And then they ask you to imagine that you are relaxing, and you can hypnotize yourself and keep on saying that I'm relaxing. There are different ways, but actually it shows, the meter shows that your pulse has gone down, your blood pressure has gone down, your nerve conduction is steady, flowed. So that is one way. The other thing is that the patient will tell you themselves that, thing which I do with my patient is that after 2 or 3 months, patient will come and tell me that, yes, doc, I'm improved, I'm doing better. And I'll say, okay, me, how you are improved? And then they will tell me and I will document it. The second question which I ask them, can you please express the improvement in your overall being in mathematical expression? Say anywhere between 0 to 100, how much are you improved? So the patient may think about it, and I will say, considering everything, and they may say 60%, or they may say 30%, they may say 90%, some may say it's day and night. So it is both an objective statement as well as a way of measuring your future treatment. As a rule of thumb, and it is my own device, that if somebody tells me that they are 60 or 65% or more improved, then I'll continue them on the same dosage for some time. But I don't take less than 50% as acceptable. And I'll say, hey, there is 50% more room for improvement. I hate you not to improve more. So then I tell them, if they come with their family members, like a spouse or mother and son, I will tell them that I'm having a small test. So I give them both a piece of paper and pen and ask them the same question and tell them to write their answer without discussing each other, to see how much close it is or far it is. So the mother may say he's 80% improved in her opinion. The son may say he's 50% improved. So I will take the average. The other thing is, psychiatry or mental health, it is much important if your family or your spouse, your knows you closely, is involved in your treatment. And I encourage my patients to bring their spouse or somebody, or even ask them. Sometimes I tell them, ask your wife to write a letter to me and comment that how you are doing in your opinion, what has not become better. How is your job? Is it still an uphill battle to go to work and finish it? So important collateral information, you collect them. And there are objective evidences as well. As I said, their blood pressure goes down. They are not complaining of tension headaches. Their bowel movement is regularized. So there are many ways in which it can be objectively documented and identified that he or she is doing better.
Your container analogy from the last episode stuck with me. Water and fire cannot exist in the same container. Similarly, anxiety and relaxation cannot exist together. If someone is using medication to damp down that fire of anxiety, what's the best daily micro habit they can build to consciously flood their container with water so they can eventually relies less on medical hardware.
The most important thing, as we talked, is deep breathing exercises. And you can find on Google practical demonstration, how it is done, and it will see the result. It can be so effective that you will fall asleep. If you incorporate this routine in your daily life, then it will keep your container saturated with water. The other thing is have a good night's sleep. And if you are not sleeping, work on it. There are a lot of advice, which is called sleep hygiene, and you may find something which works for you. If you sleep well, it takes away a lot of tension, and everybody knows that, and it's quite obvious. But good night's sleep is important. Physical exercise, especially if you sweat, sweating secretes endorphins. Give you an overall sense of well-being. So these are things which you can incorporate in your life. I see a lot of patients in old age who have not reconciled with the idea of death, and they have existential anxiety. What will happen to them, they die? And I said in one of my previous videos, make peace and compromise with the idea of death. And because it is inevitable, you have to accept this is something beyond your control. There is a very old saying, what you can change and what you can't, know the difference. So that is a very, very good advice. Think positively. Remember that we are a very small piece in the total picture of universe. Don't just think about yourself. Compare yourself with people who are better than you, then worse than you. There are 7 billion people or 8, but all have different stories. Unfortunately, a lot of people have not a happy ending story. They have pain, problems, somebody had fortune, a lot of things happen. And just a moment that tomorrow a doctor tells you that you have blood cancer. So up until now, you had no problem and you were not thankful that I have no problem. But now your real problem starts. So make use of time, one day at a time, be blessed, be thankful.
Yes, you can control what's in your control. So don't try to control everything, right?
Yes, certainly.
Dr. Kamal, thank you for bringing a raw, unfiltered medical perspective to a field that too often hides behind corporate buzzwords like behavioral health, a term you strongly disagree with. To everyone watching, we want to hear your unfiltered thoughts. How have anti-anxiety medications worked for you? What side effects tripped you up? Leave a comment below. Dr. Kamal and I will be dedicating sections of our upcoming episodes, especially to answering your questions. In our next episode, we're tackling a massive crisis, depression. We'll define its true magnitude, how it silently halts daily functioning, and confront the reality of suicide risk. Hit that subscribe button, turn on notifications, and don't miss. Take care of your mind, and we'll see you next time.